what is postural care throughout the day? And what is your experience of that?
24-hour postural care is a regime that needs to be followed for the full 24 hours. So every hour of every day.
Every hour of every day.
Yes.
Yeah.
And it obviously involves the primary caregivers. It involves the patient, if they're able to contribute.
Mm-hmm.
And then it involves the therapists, if they have therapists. And each person plays their own individual role.
So 24 hours is most definitely a routine. It's a regime.
Yeah. And when I use the word regime and postural care together, I would say that the types or how it works is that it would be dependent on that person's level of functional ability, the activities of daily living that person's performing or is able to perform, and the positions that they assume in order to perform them as independently as possible.
Those are the main functions that one needs to help a disabled person get through in 24 hours.
Yeah. If we break it down as an occupational therapist, we can say postural care happens during all your activities of daily living.
Sleeping, eating, seating or sitting, standing if you can. Standing is super important for weight bearing and all sorts of other physiological factors.
Yes.
Toileting and hygiene, and then just getting from one position into the next, so moving and handling.
It's individual. It's set for each person. There's no two people that will ever be the same.
Each individual part can be done, but if there's no continuity between each individual part, and if there's no understanding which underlies all of those functions, you will lose in one area.
Yes. For me, I think the most important part about postural care is the compliance towards postural care. And the reason I say that is because, as I said earlier, postural care is a 24-hour job. And the more compliant you are within that 24 hours, the better results you're going to get.
I love it. Compliance, it's a regime that needs to be documented, ticked off, and timed. You've got to make sure that you do things on time.
Yeah.
It helps the client. It helps the user. Let's say to go to the toilet on time, to be fed on time, to get to physio correctly. All of these things has got to run smoothly. I say that because my experience is primarily pediatrics. What else gets in the way of compliance for you?
Okay, well, can we break it down a little bit further? So, if we talk about what is postural care, so what are the aspects of postural care? When does postural care happen? It doesn't just happen in the wheelchair.
Yeah.
It happens in the wheelchair. It happens lying down in bed, and I suppose we can just say, in all other places that a person is. So, if we break it down as an occupational therapist, we can say postural care happens during all your activities of daily living.
Yeah.
So postural care, say when you're showering, maybe sitting on the commode, for example, that you're sitting on it properly, or you aren't going to get any pressure sores when you're using it. Toileting, maybe when you're sitting on the couch watching TV. And then if you say, okay, well, it's happening in all those areas, then who's responsible for it, or who teaches it? And then come back to compliance in each of those areas.
Compliance in each of those areas. That's interesting.
Because the more compliant you are within the 24 hours, the better results.
Yeah. And our ultimate goal is in each part of these 24-hour postural care functions, you have to have the best posture for that person.
Yeah.
So an understanding of what posture is vital.
Yes.
And if you haven't studied anatomy and physiology, how would you know that? So a basic manual on what a neutral or a functional or the most appropriate bodily posture is needs to be understood.